Hi everyone. In this video, we are going to discuss about Trazodone. What is this drug Trazodone? Trazodone is one of the antidepressant which is classified as SARI. The first two letters SA indicates this drug is a serotonin receptor antagonist, and the last two letters RI indicates this drug is a reuptake inhibitor of serotonin. In this way, Trazodone acts as both serotonin receptor antagonist as well as reuptake inhibitor. So Trazodone is chemically trizolopyridine 3-1 derivative. So it is having a pyridine ring which is fused with a trizol ring system. So from this we can derive the name Trazodone. Trazo indicates trizol ring and done indicates it is having a pyridine 3-1 ring system. Now, being an antidepressant, this Trazodone is used in the treatment of major depressive disorder, where this drug shows some advantages such that it shows somewhat less sexual dysfunction compared with other antidepressants. As an off-label purpose, this drug can also be used in the treatment of anxiety disorders, and this drug can also produce sedation. That's why it can also be used as hypnotic. Similarly, it can be used in post-traumatic stress disorder. In all these conditions, Trazodone increase the sedation and reduce the depressive symptoms. So today in this video, we are going to see how this drug acts, what are the important precautions, side effects, dosage, all these things we will discuss in this video. First of all, let us see the chemical nature of this drug. So this is the structure of Trazodone, and here you can observe a fused ring system. So this is nothing but trizolopyridine ring system, where trizol ring is fused with the pyridine with a ketone group on the trizol ring system. Now let us see how this drug acts. As we have discussed, Trazodone mainly inhibits serotonin reuptake, thereby increase the serotonin levels within the synaptic cleft. Similarly, it acts as an antagonist at 5-HT receptors such as 5-HT2A as well as 5-HT2C. By all of these actions, it can produce some antidepressant activity. Apart from these, this drug can also block other receptors such as alpha-2 and histamine H1 receptors. By all these actions, it can increase the serotonergic transmission, which improves the symptoms of depression. So within the CNS, 5-HT is going to be stored into the neurons. Now this 5-HT can be released and it can act on postsynaptic receptors such as 5-HT2 receptors. Now, when action potential reaches to the presynaptic neurons, calcium can enter to produce exocytosis, which release the 5-HT, and this 5-HT can act on postsynaptic receptors, resulting in postsynaptic activation. But the action of released 5-HT is controlled by its reuptake into the nerve terminal by SCRT, serotonin reuptake transporter. This transporter is having the two sides. This is the primary side and this is the allosteric side. Now, through this transporter, 5-HT can be taken into the nerve terminal. Now, Trazodone is one of the drugs which can block this SCRT so that it can prevent the uptake of 5-HT into the presynaptic nerve terminal. In this way, 5-HT levels are going to be increased, but at the same time, Trazodone can also block the presynaptic 5-HT receptors such as 5-HT2C, which are inhibitory in nature. Now, by blocking these receptors, it can prevent the inhibition so that 5-HT is more released into the synaptic cleft. Similarly, this drug can also block alpha-2 receptors as well as H1 receptors. All these increase the release of 5-HT, resulting in the improvement of depressive symptoms. Now let us see the precautions of Trazodone. One of the important precautions of Trazodone is that this drug can increase the QT interval within the ECG, so it can precipitate one of the fatal cardiac arrhythmias, torsades de pointes. Particularly, this risk is more pronounced with co-administration of other drugs, for instance, class 1A antiarrhythmics such as quinidine, class 3 antiarrhythmics such as imidazole, sotalol. All these drugs can also increase the QT interval. So when these drugs are combined with Trazodone, they can produce fatal cardiac arrhythmias. Similarly, this drug can precipitate serotonin syndrome, resulting in various symptoms such as agitation, hallucinations, confusion, some anxiety, tachycardia, hyperthermia, diaphoresis, flushing, tremor, and muscle rigidity can be observed. And particularly this syndrome is precipitated with other drugs which also increase the 5-HT levels. So when trazodone is prescribed, the development of serotonin syndrome should be closely monitored within the patients. Similarly, this drug can act on the blood vessels and it can produce increased risk of bleeding. So trazodone can produce epistaxis, bleeding from the nasal blood vessels, hematoma, and even it can produce gastrointestinal bleeding. And particularly these symptoms can be more pronounced when this trazodone is combined with other drugs such as aspirin, which is an antiplatelet agent, or warfarin, which is a oral anticoagulant, or few of the NSAIDs, which also increase the risk of bleeding. So when these drugs are combined with trazodone, the risk of bleeding is more pronounced, which should be closely monitored. Similarly, trazodone can produce some angle closure glaucoma. Since this drug is going to produce pupillary dilatation, this can increase the narrowing of canal of Schlem. In a normal patients, this is not that much significant, but in the patients with narrowing of this canal, it may lead to some severe angle closure glaucoma. Similarly, trazodone can produce hyponatremia, so it can reduce the serum sodium levels to less than 110 millimoles per liter, resulting in few of the symptoms such as headache, confusion, some loss of memory, and even fatigue. And this hyponatremia produced by trazodone is because of its inhibitory action on antidiuretic hormone. Similarly, this drug can also increase the suicidal initiation just like other antidepressants. This is more pronounced in the adolescents with age less than 18 years and young patients with age 18 to 24 years. This risk of suicidal initiation is more pronounced with trazodone. Finally, trazodone can produce orthostatic hypotension because it also blocks alpha-1 receptors, which may result in syncope in the patients. And it can also produce some somnolence, sleepiness in the patients, as well as sedation, which may impair daytime activities. And this drug can also produce priapism, painful erection of penis, and failure of ejaculation. What are the side effects? The side effects of trazodone are mainly related with central nervous system. So it can produce some dizziness, drowsiness, confusion, headache, some disorientation, fatigue, and due to vasodilatation, it can produce some edema. Gastrointestinal side effects such as constipation, dry mouth, some syncope, nasal congestion, and weight loss can be observed with this trazodone. How it is given? This drug is given as a tablet form, and the initial dose of the drug is started at 150 mg per day, which is given as divided doses. The dose can be slowly escalated up to 600 mg per day, again given as divided doses. So that's about this drug trazodone, which is a SCRI, serotonin receptor antagonist, as well as reuptake inhibitor. Increase the QT interval and sedation are the two important precautions that should be considered with this drug, and it can also develop serotonin syndrome and also increase the risk of suicidal initiation. So this drug can be used in the treatment of major depressive disorder, but as an off-label purpose, it can be indicated for anxiety disorders, as well as it can be used as hypnotic. So that's about this drug trazodone. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.